my name is Amanda. I'm from Brazil. I live in São Paulo. I studied tourism, almost finishing. Yes, finally. And I'm 22 years old. It's very complicated because Brazil is a huge country, it's like almost a continent.
Right.
So all the states are trying to insert their politics to make more like um, to be easier to control, and
Mm.
especially because we have a conflict, a politic conflict with our president and everything. I don't know if you know about it, but it's um, quite difficult
Mm.
because here in Brazil, like we are having this huge crisis,
Yeah.
and at the same time, also an economic crisis because, um, for example, here in São Paulo, in the state of São Paulo, our political representatives they told us to stop. All, so now all the trade companies and everything had to stop, and only supermarket, grocery, those essential
Mm.
commercial places are working. So plenty of companies are like working, plenty of people are getting unemployed, so we are having like a very difficult time thinking about financial stuff. Here in Brazil, now is getting into the peak of the crisis,
Right.
uh, of the coronavirus and everything, but still we have some places that don't have enough hospitals, don't have enough uh, healthy medical professionals, and our healthy system, we have the like an universal and open to everybody health system, which is very
Mm.
good. So then everybody can use it. But usually, like even without the crisis, was really crowded. So now it's getting even more, and we all know that like our system are not going to be able to support. We're trying to use reusable masks to make it easier, and also because we don't have plenty of products, so all the masks, the commercial masks that are coming to our country are going directly to the hospitals,
Mm.
and we're trying to live our best like that. Yes.
Oh.
Um, but at the same time, it isn't like a strict policy
Mm.
recommendation. It's more like a recommendation,
Yeah.
and the government of each state are doing their own like rules and everything.
Mm.
So then it's gonna be easier. So for example, here in São Paulo, in the state of São Paulo, our government told to close everything at least for until this end of this month, but probably it's gonna get longer.
Mm.
Uh, but it's complicated because in the countryside of the country, so in the small cities, people are not seeing like all the things that is happening and all the contagious um, corona and everything. So they're not taking much care. They're
Mm.
like skipping, they are doing barbecue and everything. So it's like it's not being 100% effective. Yes, here all the universities, at least most of them, are doing online classes.
Mm.
So, and here in Brazil, usually we do really well with technology, so we do not struggle with that. Though my university, for example, they made a research to see if everybody has access to internet, to a computer, to see if it's really like something that they can apply.
Mm.
And also the school system for the youngers are also happening with online classes and everything. The private ones and the public
Mm.
ones are trying to manage. Everybody's staying at home. Uh, the shoppings are closed and everything are closed, so you don't have much things to do. and most of the people that
Mm.
work are working home office, and the other ones that like had to be on the office is like okay for the government. So for example, security companies, medical companies, all those stuff. I think we all have to stay strong and try our best. Like, if you can stay at home, stay at home. If you're not, protect yourself. Like, try your best to protect, because we all can have uh this virus. So it's really important to take care, stay safe.
Okay, great. Stay safe. See you. Bye bye.
Yeah, bye.